breastfeeding is treated as this thing that is not that important. It should just happen naturally. And so we forget to provide mothers with the support they need in the workplace, in the community, in our families. You'll find a scenario where a mother is breastfeeding a newborn, but they are having very unrealistic expectations put on them. They are pumping in the workspace. They don't even have a space to pump from. They are having a lot of unnecessary pressure put on them to be just like a mother who is not breastfeeding in the workplace. Number one, not having enough breast milk. Number two, having very wrong information about breastfeeding, having unrealistic expectations, having nipple abnormalities, things like flat nipples, inverted nipples, where a mother struggles to be able to latch a child. Sometimes the nipples are a bit larger than average, and the mother needs different techniques to be able to breastfeed successfully. We have, as I said, myths where mothers don't really know the purpose of breastfeeding or how to navigate it successfully. Lack of support, so we have scenarios where mothers are indirectly discouraged from breastfeeding by family, communities, workspaces, and all that. This year, 2025, as we celebrate the World Breastfeeding Week, it's basically doing everything we can to inform people about what more they can do in order to prioritize breastfeeding. The lactation service at Nakasero is definitely different from the service that you can find at other hospitals. First of all, because there's an in-house IBCLC, there's a health professional that is specifically trained and skilled in breastfeeding and lactation issues. The hospital management, leadership, staff is very baby-friendly. A baby-friendly hospital is a hospital which is following the proper guidelines and the steps that have been set out in order to promote, support, and protect breastfeeding. For example, in a baby-friendly hospital, you won't find health workers manipulating mothers into feeding their babies on formula. In a baby-friendly hospital, you won't find mothers being given free samples of formula. Yes, so there's a lot of effort put into making sure that mothers access that professional help with breastfeeding. An antenatal breastfeeding class. In that class, we cover how to handle or avoid common breastfeeding problems, how to keep your supply up in a way that works. You get an assessment of your breasts. Do you have any abnormalities? We cover the working mother, pumping, getting back to work, what's realistic, what's not, storage of breast milk, handling your breast milk. You can actually even bring along your caretaker, and they can learn some of these things so that when you leave them with your baby, they know how to handle the breast milk. You can never go wrong with preparing for breastfeeding. It's something that you'll always be glad you did. We as Nakasero are inviting you for our maternity classes, our antenatal classes, and our expert breastfeeding and lactation sessions. Happy World Breastfeeding Week.